Hey everyone, my name is Pranav Mandyam, and I'm part of RISE's chapter for the American Lung Cancer Screening Initiative, or ALCSI for short. Today, we'll be giving a presentation to you on lung cancer and lung cancer screening. We're grateful for the opportunity to present to you today. Before I get into the content of this presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit organization that works to raise awareness for lung cancer and lung cancer screening. We're a team of over 70 passionate students and doctors located around the United States. We work with community organizations such as the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. Today, we'll discuss both lung cancer and lung cancer screening, addressing questions such as how common lung cancer is, what is lung cancer screening, and how you can get screened. To start things off, lung cancer is very common. It's the second most common cancer in the United States, excluding skin cancers. This graph shows the American Cancer Society's estimates for the number of new cancer cases in the United States. This graph estimates that new cancer cases in 2022 for the four most common cancers. As you can see, it's estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the US. To put this in perspective, it's estimated that about 6% of people will develop lung cancer during their lifetime in the US. That means that 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it's also very fatal. Lung cancer is the leading cause of cancer-related deaths in the US and the world. In 2022, it's estimated that lung cancer will claim the lives of 130,180 people. This graph shows the American Cancer Society's estimates for the number of cancer-related deaths in the US. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer combined. Every lung cancer makes up almost 25% of all cancer-related deaths, resulting in about 350 deaths per day. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. If you look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males, at an incidence rate of 71.7 per 100,000 people. Among females, lung cancer incidence is highest in white females at an incidence rate of 51.1. Mortality rate mirrors incidence rates. So Black males have the highest mortality rate among males, while white females have the highest mortality rate among females. From this data, the question arises is why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. This is a graph looking at the proportion of patients with lung cancer by stage. Stage is a way for doctors to classify a cancerous tumor based on its tumor size, if the cancer is spread to lymph nodes, and if the cancer is spread to other locations in the patient's body. Currently, most lung cancers are diagnosed at a distant stage, where the cancer is spread beyond the site within the lungs where it originated in. This graph is based off of data from 2008 to 2017, published in the National Cancer Institute. As you can see, about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, where the cancer is already spread to the other locations in the body. So why is this important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival. We'll see this in the next slide. One way that doctors can track survival of patients is by looking at the 5-year survival. As you can see here, the 5-year survival for lung cancer at an early stages is high, but the 5-year survival significantly drops as the disease progresses. This graph is another way to understand the relationship between stage at diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at this stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And this is why lung cancer early detection is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients are diagnosed with late stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. The most common symptoms of lung cancers are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it's more difficult to treat and the prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it's difficult to catch lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung cancer screening. Lung cancer screening is done using something called low-dose computed tomography scanning. If you're eligible for lung cancer screening, it's recommended that you get an annual lung cancer screening. In the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography or low-dose CT scans and not chest X-rays. We use low-dose CT scans because it provides more detailed pictures than chest X-ray and is better at finding small abnormal areas in the lungs. The picture on the left is a picture of the chest X-ray. The yellow arrows point to the abnormal areas in the lungs, but it's unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. The red arrow points to the abnormal area in the lungs. As you can see, the image is more detailed than the chest X-ray and enables you to see an abnormal area in the lungs with greater detail. The question that researchers wanted to answer is, how effective is a low-dose CT scan at detecting lung cancers in an earlier stage? An important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this question. The NLST was a large national study with over 50,000 patients. The goal of the study was to determine the effectiveness of using low-dose CT scans to detect lung cancer early in patients considered high risk for lung cancer. The study included two groups, a group of patients who received an annual low-dose CT scan and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were detected between these two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an earlier stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scans caught the most lung cancers at an earlier stage, while the chest X-ray diagnosed more patients at stage 4. This has important implications for survival. Because the low-dose CT scan caught more lung cancers at an earlier stage, these cancers were more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to a chest X-ray. As you can see, a concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung screening, 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at catching people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive, and the test will not miss your cancer. Now, if we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer, primarily through follow-up imaging alone. This means that even if your test results is a false positive, it's really easy to rule out cancer using further non-invasive imaging. The 2 individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an earlier stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are much better. The results of the NLST were published in 2011, 10 years ago. Several studies have been published since then, further confirming the life-saving benefits of lung cancer screening in high-risk populations. One of the most important is the Nelson trial. In February of 2020, the results of the Nelson trial were published. Like the NLST, the Nelson trial had two groups. However, unlike the NLST, the Nelson trial had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0 or baseline, year 1, year 3, and year 5.5 or no screening. The results confirmed the life-saving benefits of lung cancer screening and by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed as stage 1. And in the non-screening group, 13.5% of lung cancers were diagnosed as stage 1. Early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to the no screening group. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. Lung cancer screening significantly reduces lung cancer mortality, but who should get screened for lung cancer? The United States Preventative Service Task Force, also known as USPSTF, sets guidelines for who should get screened for lung cancer. Right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or greater, and who are current or former smokers who quit within the past 15 years, get an annual low-dose CT scan. The current screening guidelines require you to have a 20-pack-year smoking history. Now, a pack year is probably a term that most of you have not heard of before, but it's just a way for doctors to track your smoking history over time. A pack year is defined as smoking a pack of cigarettes per day for a year. For example, if you were to smoke 1 pack a day for 20 years, then that would equate to a 20-pack-year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate for a 20-pack-year smoking history. The important takeaway is that there are many different ways to reach a 20-pack-year smoking history. And the pack year is just a way to help doctors to track your smoking history. Smoking is a primary risk factor for lung cancer. When compared with people who have never smoked cigarettes, a current smoker has a 25 times greater risk for lung cancer. About 8 out of 10, or 81% of deaths from lung cancer in 2022 are expected to be caused from smoking cigarettes. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, secondhand smoke causes almost 3% of new diagnoses for lung cancer and is expected to cause about 3% of deaths in 2022. Additional risk factors include exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It's important that we recognize these additional risk factors because although lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked that still get lung cancer. Never smokers are defined by individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts to about 10 to 20% of lung cancer diagnoses and is the 8th leading cause of cancer-related deaths in the United States and in the world. Moreover, more never smokers die from lung cancer each year than people die from ovarian cancer. This graph shows the proportion of lung cancer cases that occur in people who have never smoked in their life and people who have smoked in their life and people who have never smoked. It is then further broken down by whether they're a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is the current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should get screened for lung cancer. In summary, lung cancer is the leading cause of cancer-related deaths in the US. It is so deadly because most lung cancers are diagnosed at a late stage, where they have spread to other locations of the body. Importantly, early detection of lung cancer screening by the use of low-dose CT scans can reduce the lung cancer mortality by up to 33%. Currently, only 5% of high-risk individuals are currently getting screened for lung cancer. To highlight how low this number really is, if we compared the lung cancer screening rate to the screening rate of breast, cervical, and colon cancer. All 4 of these cancers have screening tests that are recommended by the USPSTF. Right now, only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison with the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we are only screening only 5.7% of them, which means that a lot of lives that could be saved are not getting saved. And why is that? The lung cancer screening rate is so low because of a couple different reasons. These reasons include limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next slides, we'll discuss each of these 3 topics. The important takeaway, though, is that lung cancer can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there's a few exceptions. Number 1, Medicaid will only cover lung cancer screening until the age of 77. 2, not all Medicaid plans cover lung cancer screening. And 3, patients will still have to pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover the lung cancer screening. Here's a map updated in September 2021, showing which state Medicaid plans do and do not cover lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening. In purple states, their Medicaid plans do not cover lung cancer screening. In pink states, the particular information is not available. The first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that have to be discussed. One of these is the patient's pack-year smoking history, which we saw how to calculate in earlier slides. To find accredited lung cancer screening centers, the patients can go to the American College of Radiology website. They can type in their state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed in the bottom left-hand side of the screen. As far as how the experience of getting low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. We will be doing something very similar to patients in the photo here. One thing to note is that this process will not hurt at all, and because this is a low-dose CT scan, you do not use contrast. This means that there will not be any needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very low. A way that doctors measure the amount of radiation a patient may receive is through a unit called millisieverts. It's just a way to measure radiation and compare the levels of radiation received during different activities over time. For a low-dose CT scan, you will be exposed to 1.5 to 2 millisieverts of radiation. This is a lot lower than a full chest CT scan, which requires a radiation dose of 8 millisieverts. To put this in perspective, you're exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and the radiation from Earth. So a low-dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening test is really, really small. That being said, this is always something that patients can discuss with their primary care provider. So a patient talked with their primary care provider. The PCP referred the patient to a screening center and they received a low-dose CT scan. What next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as the results go, there are three most likely outcomes. The first outcome is that the scans are normal. If that is the case, then patients should look to get repeat scans in a year. If the scans are abnormal but probably benign, the patient should talk to their doctor about the next steps. This may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. So lung cancer screening saves lives. But a question that you may be wondering is, can individuals get screened for lung cancer during the COVID-19 pandemic? And is it safe to do so? During the pandemic, the number of cancer screenings have decreased significantly. However, lung cancer won't stop just because of the pandemic. If a patient is at high risk for developing lung cancer, it's important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire lung cancer screening process. If patients follow the necessary precautions, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Another question that we often get is how vaping and e-cigarettes use affects lung cancer risk. Vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it's clear that for individuals who have never smoked before, they can increase the risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions in the electronic e-cigarette device. Various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, but it's not a risk-free activity. Vaping can increase the heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarettes device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern in the future. Additionally, while lung cancer screening has the potential to save many lives, it's important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not only a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. So using both is the best way to fight the disease. For every year after an individual quits smoking, the risk for lung cancer is reduced by 8% to 17%, depending on the type of lung cancer that they have. Another reason that smoking cessation is so important is because it's required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of different resources for people trying to quit smoking. Some great programs are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition Quit Smoking Program. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase lung cancer screening rate. Lung cancer is the deadliest cancer in the world. And while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We're working on addressing all aspects of this issue. We wrote and advocated for House and Senate resolution expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. Last December, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country about lung cancer and lung cancer screening. Lung cancer is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiating lung cancer screening programs in our communities. We believe that educating communities, especially students, about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. Students greatly impact and influence the healthcare of their parents, and we hope that by educating students about the important measures that can be taken, we will not only be able to help the students, but also their family members. Thank you so much for listening in to our presentation. And if you would like to subscribe to our monthly newsletter or have any questions, please feel free to send an email to info@alcsi.com. In addition, our website, our Instagram handle, and our Twitter handle are listed below. Thank you so much and have a good day.